Thank you, Anna. Just how affordable is the Affordable Care Act for young people? Turns out not very much. For ObamaCare to work, 2.7 million Americans ages 18 to 35 must sign up. As for the cost, the premiums for a healthy 30-year-old man will rise 260%, and a healthy young woman will see her cost rise about 193%. With nearly half of our nation's unemployed under 34, how will young Americans afford to get covered? Well, joining us from the Independent Women's Forum, Heath is here. Hadley, welcome to the program on this Sunday morning.
Good morning, Mike.
So I had those numbers right? So nearly 3 million people need to sign up if this Health Care Act is going to be successful at all.
That's right, and you mentioned the name of the act, the Affordable Care Act. It seems less than affordable for many Americans under the age of 30 who will be facing steep increases if they buy their own insurance. And that pool is in fact growing as we see fewer young Americans in the workforce. So
get right into the penalties here. If I decide, okay, I'm 28 years old or whatever, fairly healthy, and I don't sign up, what's the penalty going to be?
Well, some people have pointed out that it's only $95 in the first year, but that's not exactly true.
Look down the road.
If you have a salary, then in the first year it's 1% of your income, in the second year 2% of your income, and then 2.5% of your income in years after that, or $695, whichever of those is higher.
But for women, we've heard that, you're going to have better, you might get birth control pills and maternity care. It's going to be better, the higher quality health care.
Right, but who decides? Who is it who should be telling me what is better for me? A better health system would be one where individuals make that decision rather than the federal government. I think it's, in fact, pretty paternalistic to tell young women and young men that this will be better for you. What's actually better for me, that should be my decision.
Okay, if you're a young person watching right now, what is your advice? Because you got to decide what you're going to do. What's your advice?
Right. Well, if you're under 26, you should explore going on your parents' plan. That's the White House idea of what's best for young people. But there are other options for young adults. Don't be scared into going to the ObamaCare exchanges. You may be able to buy individual insurance outside of the exchanges, depending on which state you live in. If you can get employer-sponsored insurance, that's going to be your best bet because those benefits are tax-free. And also, I'd encourage young people to be wary of going on Medicaid, since the pool of doctors and quality of health care in that program are a lot less than what you'll find with
Well, expand on that a little bit.
Private market insurance.
Expand on that a little bit. Why would you advise that?
Well, if you can't afford private insurance over Medicaid, health outcomes in Medicaid and the number of primary care physicians, for example, who will see Medicaid patients is a lot lower quality. It's about 30% of primary care physicians have decided not to open their practices to any more Medicaid patients. So that's not even a good, even if the insurance is, so-called free.
Not to pry into your personal life, what are you going to do?
I got a letter from my health insurance company letting me know that my private plan is being canceled next year on my anniversary date. So I'm in that process right now, exploring my options, looking in what can I do. If I can go into some kind of family coverage, that's what I'll do.
Yeah.
Otherwise, I may seek employer-sponsored insurance if I can strike that bargain with my boss.
Happy anniversary. Hadley, thank you for being with us. Okay. You've probably seen this, or maybe you've even, maybe a guilt